Hello everyone. So in this PPT will be the continuation of the other two PPT. We'll discuss about cardiomyopathy as well as cardiac tumor in this. So cardiomyopathy can be of three types. So it can be dilated, hypertrophy as well as restrictive. So this cardiomyopathy will result in heart failure. So you should know which cardiomyopathy will result in systolic failure or which one will result in diastolic failure. So coming to dilated cardiomyopathy. So dilated cardiomyopathy is here the heart will undergo both dilatation as well as hypertrophy, and there will be a systolic dysfunction in the heart. So here the ejection fraction will be maintained below 40% as there is a defect in the contractile function of the heart. So coming to etiology, the most common causes of dilated cardiomyopathy are related to the genetic mutation. So there can be mutation in the cytoskeletal sarcolemmal proteins, and non-genetic causes can be of myocarditis, peripartum, toxic, Takotsubo syndromes and idiopathic. Coming to arrhythmogenic cardiomyopathy, this is an autosomal dominant disorder which is usually caused by the mutation of the genes involving the desmosomal junctional proteins. So here the patient will have a right-sided heart failure as well as a rhythm disturbance. So due to rhythm disturbance, this patient will have a sudden cardiac death. And one of the examples of arrhythmogenic cardiomyopathy is Naxos syndromes. So coming to hypertrophic cardiomyopathy. So in hypertrophic cardiomyopathy, the heart will undergo hypertrophy and there will be a abnormal diastolic filling due to hypertrophy. So here the diastolic function is affected. So there is a normal contractile function of the heart. So the ejection fraction will be maintained till 80%. And in about 1/3 of the patient, there may be also ventricular outflow obstruction can also occur. So coming to etiology, there will be mutation of the myosin binding proteins as well as tropomyosin. On autopsy, when we have a cross sectional of the heart, the normal round to ovoid shape of the ventricle will be compressed into a banana-like shape. Okay. So this they can ask banana-like shape of the ventricle is seen in which cardiomyopathy? It is seen in hypertrophic cardiomyopathy. So coming to restrictive cardiomyopathy. So restrictive cardiomyopathy, there is a decrease in the ventricular compliance of the heart. So there will be impaired ventricular diastolic filling. So the ejection fraction is maintained till 60%, and the etiology behind it will be idiopathic, amyloidosis, sarcoidosis, or radiation-induced fibrosis, or due to the accumulation of metabolites from due to inborn error of metabolisms. So endomyocardial fibrosis is a form of restrictive cardiomyopathy. These are seen in children as well as young adults in Africa, and here it is linked to the nutrition deficiency or due to syndromes associated with hypereosinophilia. Okay, so here the fibrosis may extend even to the walls like tricuspid as well as mitral wall can be also undergo fibrosis in these conditions. So coming to Loeffler's Loeffler's endomyocarditis is nothing but a endomyocardial fibrosis. So here it is associated with peripheral eosinophilia, eosinophilic infiltrate into the multiple organs. So here the fibrosis is mainly due to the release of toxic product from eosinophils, which may cause endomyocardial necrosis followed by scarring. Next is endocardial fibroelectrosis. Here usually occurs within the first 2 years of age, and main etiology is viral infection or the mutation of the tafazin gene. So coming to next cardiac tumors. So the most common cardiac tumors are usually secondary. So coming to primary cardiac tumors, this myxoma is the most common cardiac tumor seen in adults, and the most common site is atria. Okay, and here the patient will have the ball wall obstruction symptoms, embolization, or generalized symptoms like fever and malaise. So this is a gross as well as a microscopic image of the myxoma. So papillary fibroelastomas, they have a gross C animal shaped appearance, and they are located in the walls. Okay, so microscopically they will have a increase in the there will be abundance of mucopolysaccharide matrix will be present. Next tumor is rhabdomyoma. This rhabdomyoma is the most common primary tumor seen in pediatric age group. So in adult age group, myxomas is common. In pediatric age group, rhabdomyomas are common. So here it is associated with the mutation in the tubular sclerosis complex, and they are grossly these are grey white in color and involve the ventricles, and microscopically there is a characteristic spider cells will be present. Okay.